Well, hello again. This time we are going to do the joints and then we'll be done with the skeletal system. So while doing joints, the first thing I want to do is define the three types of joints we have. And as you all know, we have fibrous, cartilaginous and synovial joints. As a general rule, fibrous and cartilaginous belong to the axial skeleton, whereas most synovial joints belong to the appendicular skeleton. There are exceptions, of course. So let's begin with fibrous joints. Now there are three types of fibrous joints. The sutural joints, the joints between the skull bones. So this is the coronal suture, the sagittal suture, and then the lambdoid suture. The second type of fibrous joints are joints which are present between the teeth and the jaw. So between the tooth and the mandible, and the tooth and the maxilla. This type of fibrous joint is known as a gomphosis. Most fibrous joints do not allow any movement. The sutural joints don't allow any movement. Gomphosis allows a little bit of movement, which is done when you're chewing. So, the teeth move within their sockets. It's a very, very slight movement. The tooth is connected to the socket by means of fibrous tissue, and this movement is not something that you can see or feel. The third type of fibrous joint is known as a syndesmosis. And a syndesmosis, one example of a syndesmosis is the joint between the lower end of the tibia and the fibula. So this is the inferior tibiofibular joint. So this is a syndesmosis, and this also allows a slight degree of movement, and that movement occurs especially when you jump from a height. Then the two bones play apart so that the fibula, which is a very, very thin bone, does not break. So these were the fibrous joints. The second type of joint is the cartilaginous joint, and here we have the primary cartilaginous joint, which is between the epiphysis and the diaphysis, between the lower epiphysis and the diaphysis again of the humerus, again between the epiphysis and diaphysis of the radius, or the epiphysis and diaphysis of the ulna, and the same holds true for the lower limb bones. So these are primary cartilaginous joints, and there is a bit of hyaline cartilage which intervenes between the epiphysis and the diaphysis. As you all know, hyaline cartilage usually ossifies. So when that ossifies, the epiphysis and the diaphysis fuses and that joint is actually represented by a little line which is known as the epiphyseal line. So you see a little line present which is called the epiphyseal line. So these are temporary cartilaginous joints. The second type of cartilaginous joint is what is known as a secondary cartilaginous joint. This temporary was called primary. The second one is called secondary cartilaginous joint. These are permanent, and here between two bones where you have again cartilage, but this time the cartilage is fibrocartilage present between the two bones, and this case this is an intervertebral joint. So you have the two vertebrae and the fibrocartilage in between. These secondary cartilaginous joints are also called midline joints or symphysial joints. So they are present between the vertebrae with the fibrocartilaginous discs in between. We call them midline because you see them in the midline. The joints between the vertebrae, these intervertebral joints, these are secondary cartilaginous. The joints between the three pieces of the sternum, the manubrium and the body, the manubriosternal joint, which is this area, between the body and the xiphoid process, the xiphisternal joint. Again, you have fibrocartilage discs between these three pieces. So, these are also secondary cartilaginous joints. Then we have the joint which is present between the two hip bones, this area. You can see this disc of fibrocartilage. This is called the pubic symphysis, again a secondary cartilaginous joint. The third type of joint which we are going to do are the synovial joint. And these synovial joints are mainly seen in the appendicular skeleton. And these are extremely mobile. The fibrous joints don't move at all. The cartilaginous joints, especially the secondary cartilaginous, allow a slight degree of movement, and the synovial allow a great degree of movement. There are always exceptions to the rule. For example, you have syndesmosis, which allows movement but is which is a fibrous joint. You have the primary cartilaginous joint, which does not allow any movement but is a cartilaginous joint. And then in the synovial joints, you'll see some joints called plain synovial joints. For example, the acromioclavicular joint. This is a plain synovial joint which allows just a slight degree of gliding movement. But on the whole, synovial joints allow a greater degree of movement as compared to fibrous and cartilaginous. Now, let's begin with the first type of synovial joint, which is a plain synovial joint, where the two surfaces are plane. And one good example, which you see here, is this, the acromioclavicular joint, and this is a plain synovial joint. Slight amount of gliding takes place. So, there is a gliding movement which occurs in this joint, and this gliding movement often dislocates this joint, especially in sports like contact sports, soccer. When somebody is hit over here on the shoulder, these two articular surfaces may move apart, and you might have what is known as subluxation of the joint. The second type of synovial joint is called a pivot joint, where you have movement only in one axis. So, you can only do one kind of movement. And that movement in a pivot joint is a rotatory movement. So, you can rotate. Examples of pivot joints are the joints between the atlas, the first cervical vertebra, and the axis. So, between the atlas and the axis, where you do this movement of you turn your head around, the entire skull with the atlas moves around. So, it moves around. So, this is the atlantoaxial joint, which is a type of pivot joint. And the second example of a pivot joint is the radio-ulnar joint between the radius and the ulna. So, we have a superior and an inferior radio-ulnar joint. So, you have a superior and inferior radio-ulnar joint where the radius moves across the ulna and then moves back, as when you do pronation and supination. So, in pronation, the radius moves across the ulna, and in supination, the radius lies parallel to the ulna. So, that is a pivot joint. The other joint which allows movement in one axis is known as the hinge joint. And a good example of the hinge joint is your elbow joint, the elbow joint. Here the movement is not rotatory, instead it's a movement of bending and straightening. So you have flexion and you have extension. So you are only allowed to do these movements, flexion and extension. So the elbow joint, which is between the lower end of the humerus and the upper ends of the radius and the ulna. So this is a hinge joint. Other hinge joints are the interphalangeal joints. So your interphalangeal joints, where you can do this movement again of flexion, extension, flexion, extension. So this again is a hinge joint. The ankle joint, which is a modified hinge joint, and this is between the lower end of the tibia, the lower end of the fibula and the talus. This is a hinge joint but somewhat modified. Here the movement is dorsiflexion and plantar flexion. When you do dorsiflexion, you cannot move your foot in a side to side manner. When you do plantar flexion, the foot can be moved medially and laterally. So that's why we call this a modified hinge joint. Some people classify the knee joint. The knee joint is classified by some as a hinge joint. Some people classify this as a condyloid joint based on the surfaces. This too is modified. So here again you can do flexion and extension. So you can do flexion and extension. But during the last few stages of flexion and during the first few degrees of extension, there is a slight degree of rotation which occurs in the joint. So therefore we call this also a modified hinge joint. So movement in one axis. The second type, or rather the third type of synovial joint is one where you can move in two axes. So you have the wrist joint, which is a biaxial joint between the lower end of the radius, the proximal row of carpal bones. So the movements here are flexion, extension, adduction or medial or ulnar deviation, abduction or radial deviation or lateral deviation. So we have flexion, extension, adduction, abduction. So that is the wrist joint. Another type of joint is the saddle joint, which is the carpo-metacarpal joint of the thumb, the carpo-metacarpal joint of the thumb, which is this point here, the carpo-metacarpal joint of the thumb, where you can do flexion, extension, adduction, abduction. When you do flexion, there is medial rotation which accompanies it. When you do extension, there is lateral rotation which accompanies it. So that's why this is called modified. The other joints which allow, again like the wrist, which allow two axes, movement along two axes, are the joints between the heads of your metacarpals and the proximal phalanges, which are called these metacarpophalangeal joints along the knuckles. So here you can do a movement of flexion, extension, abduction, adduction. So abduction is when your fingers are pulled apart, adduction is when they get together, and the axis is along the middle finger. So, along the middle finger, if all the other fingers move towards the middle finger, that's adduction. When they move away, that's called abduction. In the foot, it is the second toe which is taken as the axis along which the abduction and adduction is determined. So, these were joints which are called biaxial joints. The other joints which I described, where you had movement along one axis, we call them uniaxial joints. And then finally, we have joints which are multiaxial. That means movement along all three axes. And these are called ball and socket joints. You have the shoulder joint, and in the lower limb, you have the hip joint. In the shoulder joint, the movements possible, the same goes for the hip joint. You have flexion, extension, abduction, adduction, medial rotation and lateral rotation. So, you have medial rotation, lateral rotation, abduction, adduction, flexion and extension. You can do the same with the femur. The only difference is that in the shoulder joint, the head of the humerus is much larger than the glenoid cavity. In the hip joint, the head of the femur fits snugly inside the acetabulum. So, this joint is more stable, but it is at the cost of mobility. So, you don't get as much mobility in the hip as you get in the shoulder joint, which is why the shoulder joint gets dislocated more often than the hip joint. And to protect the shoulder joint, and you will be doing this when you do the muscles, you actually have many muscles which envelop the shoulder joint, as you can see here. So, here we are looking at the shoulder joint, and you can see all these muscles which kind of go around the shoulder joint, and they sort of form a cuff around the shoulder joint, and this cuff is known as the rotator cuff, and that helps to stabilize the shoulder joint because of this fact that the head of the humerus is so much larger than the glenoid cavity that this joint is so mobile, and when anything is so mobile, there is always a tendency for it to dislocate. The hip joint is very snug, but it also has extremely strong ligaments anteriorly and posteriorly. While you have all these ligaments present, this joint is very, very stable. Those ligaments also are extremely strong, and so they stabilize the joint even more. And then lastly, I would like to show you the knee joint. And here we are looking at the knee joint, a very, very complex joint. It has the lower end of the femur, the upper end of the tibia, and the patella. This joint has fibrocartilagenous discs present, and these discs are known as menisci, and they divide the joint cavity into compartments. The joint has numerous ligaments. The tendon of the quadriceps lies anteriorly, and then we have the collateral ligaments, and within the joint cavity we have ligaments which are the cruciate ligaments. So, the cruciate ligaments which add stability to the joint. So, these are the cruciate ligaments, and these are the ligaments which are often torn whenever one has an injury to the knee joint during any sport, especially soccer and football. So, with that we complete the joints, and I hope this has been very useful to you.